Our skin often speaks to us, revealing clues about our overall health. It acts as a mirror, reflecting what's happening inside our bodies. Sometimes these clues come in the form of rashes or unusual markings. These signs can be alarming and often prompt us to seek medical advice. Large Plaque Parapsoriasis, or LPP, and Pityriasis Lichenoides, or PL, are two such skin conditions that can be puzzling. They present with distinct yet sometimes overlapping symptoms, making diagnosis a challenge. They often leave people searching for answers, feeling anxious and uncertain about what these skin changes mean. These conditions can be confusing, even for experienced dermatologists. The subtle differences between LPP and PL require careful examination and sometimes additional tests to confirm. But don't worry, knowledge is power. Understanding the nature of these conditions can alleviate some of the stress and help you take proactive steps. By understanding these conditions, we can better manage them and find the right treatment path. This involves not only medical treatments, but also lifestyle adjustments and ongoing skin care. This essay will delve into the world of LPP and PL, shedding light on their causes, symptoms, and treatment options. We will explore the latest research and expert recommendations. Let's embark on this journey to decipher the language of your skin. Together, we will uncover the mysteries of LPP and PL, empowering you with the knowledge to take control of your skin health. Large plaque parapsoriasis, or LPP, often sparks debate in the dermatology community. This condition, while not as widely known as some other skin disorders, has been the subject of numerous studies and discussions among experts. The complexity and ambiguity surrounding LPP make it a fascinating yet challenging topic for dermatologists. Some experts see it as a distinct skin disorder, separate from other conditions. They argue that LPP has unique characteristics that set it apart, making it a standalone diagnosis. Others believe it's an early form of a more serious condition called Mycosis Fungoides, or MF. This perspective is based on the similarities in the appearance of skin patches and the histological features observed under a microscope. MF is a type of lymphoma, a cancer of the immune system. It primarily affects the skin but can progress to involve other organs if not diagnosed and treated early. LPP typically appears as red patches on the skin. These patches can vary in size and shape, often causing discomfort and concern for patients. These patches are often found in areas protected from the sun, such as the torso, back, and thighs. This distribution pattern can sometimes help in differentiating LPP from other skin conditions. This can make it tricky to diagnose because it can look like other skin conditions, including early MF. The overlapping features often necessitate a thorough examination and multiple diagnostic tests. Under a microscope, untreated LPP can resemble MF. The histological similarities add another layer of complexity to the diagnostic process. However, most LPP cases don't progress to a life-threatening stage. The condition tends to remain stable over time, with many patients experiencing only mild symptoms. The good news is that people with LPP generally have a normal lifespan. With proper management and regular monitoring, patients can lead healthy, fulfilling lives. To get an accurate diagnosis, doctors rely on a combination of factors. These include the patient's medical history, physical examination, and the appearance of the skin patches. These include clinical examination, skin biopsies, and sometimes even specialized tests to analyze T cells. Advanced diagnostic techniques can help differentiate LPP from other similar conditions, ensuring that patients receive the most appropriate treatment. Pityriasis Lichenoides, or PL, is another unique skin condition. It has two main forms, Pityriasis Lichenoides et Varioliformis Acuta, or PLEVA, and Pityriasis Lichenoides Chronica, or PLC. Think of these forms as two ends of a spectrum. Both forms share a common feature, recurring eruptions of small, raised red bumps, also known as papules, that eventually fade away on their own. PLEVA lesions tend to crust over or even ulcerate. PLC lesions, on the other hand, often have a scaly appearance. Some people experience a blend of both types. Pityriasis Lichenoides, or PL, has a fascinating history. It was first described in the 19th century. Back then, it was grouped with other skin conditions under the umbrella term Parapsoriasis. Over time, dermatologists recognized the unique characteristics of PL. Today, it stands as a separate entity in the world of dermatology. Section 5. Who gets PL? Understanding the demographics. PL can affect anyone, regardless of age, race, or where they live. However, it seems to be more common in children and males. While the exact reasons for this remain unclear, understanding these patterns helps doctors identify and manage the condition more effectively. Section 6. The why behind the rash causes of PL. The exact cause of Pityriasis Lichenoides, or PL, remains a mystery to the medical community. Despite extensive research, the precise origins of this condition are still not fully understood. However, researchers believe that several factors might play a role in the development of PL. These factors are thought to interact in complex ways, leading to the manifestation of the condition. One prominent theory suggests that PL could be triggered by foreign antigens. These antigens are substances that the body perceives as threats, prompting an immune response. When these antigens enter the body, the immune system reacts by producing antibodies to fight them off. This immune response can sometimes lead to the skin manifestations seen in PL. Infections and certain medications are examples of potential triggers for this immune response. Various types of infections, including bacterial and viral, have been implicated in the onset of PL. In fact, Pityriasis Lichenoides et Varioliformis Acuta, or PLEVA, one of the forms of PL, has been linked to viral infections like chickenpox. This connection suggests that the immune system's response to these infections may play a crucial role in the development of PL. PL can also be associated with reactions to drugs, vaccines, or other infections. These reactions can trigger an immune response that leads to the characteristic rash of PL. Both PLEVA and Pityriasis. Lichenoides Chronica, or PLC, involve T cells, a type of white blood cell that's crucial for immunity. T cells play a key role in the body's defense against infections and other foreign substances. Sometimes these T cells show signs of clonality, meaning they're all copies of a single cell. This clonal expansion of T cells suggests that there may be an underlying abnormality in the immune system that contributes to the development of PL. This finding suggests a connection between PL and certain lymphoproliferative disorders like Mycosis Fungoides, which also involve abnormal T cell growth. Understanding these connections may help researchers develop better treatments for PL in the future. Ongoing research is crucial to uncovering the exact causes of PL and developing effective treatments. By studying the immune system and its responses, scientists hope to find ways to prevent and manage this condition more effectively. Until then, understanding the potential triggers and immune responses involved in PL can help medical professionals provide better care for those affected by this condition. Continued research and collaboration are key to unlocking the mysteries of PL. Section 7. Spotting the different clinical features. PL typically presents as recurring red papules. These bumps often fade over time. PLEVA lesions can be more dramatic, progressing to crusts, ulcers, or even pus-filled blisters. In some cases, they leave behind scars. PLC lesions are usually less aggressive. They tend to have a scaly appearance and take longer to resolve, sometimes weeks or even months. The challenge with PL is that it can mimic other skin conditions like guttate psoriasis or lichen planus. Section 8. Under the microscope. Pathology of LPP and PL. Examining skin biopsies under a microscope provides valuable clues about LPP and PL. In PL, we often see a gathering of lymphocytes, a type of white blood cell, around blood vessels in the skin. Acute lesions might show damage to the epidermis, the outer layer of skin, ranging from swelling to cell death. Chronic PL, on the other hand, shows milder changes under the microscope. The lymphocyte infiltrate is less intense. Atypical variants like lymphomatoid Pityriasis Lichenoides can closely resemble T-cell lymphomas, making accurate diagnosis challenging. Section 9. Ruling out other suspects, differential diagnosis. Distinguishing PL from other skin conditions is crucial for effective treatment. Conditions like lymphomatoid papulosis, chickenpox, and drug eruptions share some similarities with PL. Dermatologists rely on a combination of clinical examination, multiple skin biopsies, and sometimes advanced laboratory tests to make an accurate diagnosis. Differentiating PL from conditions like guttate psoriasis or secondary syphilis can also be tricky. Section 10. Treatment options, navigating the path to clear skin. Unfortunately, there's no one-size-fits-all treatment for PL. Treatment recommendations are often based on individual cases and limited studies. First-line treatments typically include topical corticosteroids, macrolide antibiotics like azithromycin, and narrowband UVB phototherapy. For severe cases or those with systemic involvement, doctors might consider stronger medications like methotrexate or TNF inhibitors. While PL often resolves on its own, long-term management might involve repeated treatment courses. Section 11, a positive outlook, prognosis and importance of dermatology. The good news is that PL in most cases has a good prognosis. While it can be a nuisance with its recurring nature, it's generally not life-threatening. However, early diagnosis and proper management are key to preventing complications and improving quality of life. If you suspect you might have LPP or PL, don't hesitate to see a board-certified dermatologist. They can provide an accurate diagnosis and guide you toward the most effective treatment options. Remember, your skin is a reflection of your overall health, and taking care of it is an investment in your well-being.